In the celiac disease clinic, I'll see patients where there's a question of could they have celiac disease. So typically those patients are coming to me with celiac disease lab screening that may be abnormal, and so they come to get that evaluation to find out whether they have celiac disease or not. I also see patients that have a known diagnosis of celiac disease, and then we also have some patients where they fall in a bit of a gray zone and they don't definitively have celiac disease, but they could, and so we also work through that diagnostic process to try to figure that out over time. The nutrition clinic is for patients with growth faltering, so difficulty gaining weight. It can also be with patients that are dependent on enteral nutrition, which is formula feeding by a tube, which could be part or all of their nutrition. And then other patients that have complex medical problems where nutrition is an important factor in that, whether the medical condition is causing them difficulties with nutrition or just supporting their nutrition is helpful in managing that. In the celiac disease program, as well as the comprehensive nutrition program, both clinics are multidisciplinary and really hinge around having both gastroenterologist and dietitian collaborate together to provide the best nutritional care for the patient. It's really helpful, especially for these patients and families that have these complex medical problems. They may have to go to a lot of appointments, see a lot of doctors, and so this is a way for them to get that care in one visit as opposed to two separate visits. But aside from that, it's really collaborative and allows us to formulate a comprehensive plan between ourselves and the family, and I think that provides better care. At Lurie Children's, everything is really focused around the child. Of course, their family too, but we really want to be a kid-friendly environment, and we try to engage the patients and their families and make them feel comfortable.